One of the biggest things that I think challenges doctors or prevents doctors from helping more dry eye patients is how they talk to their patient or how they frame the conversation. So I have a great example. A colleague of mine, Alex Shiro, he always used to say that when doctors speak to patients about myopia management, they should talk to patients like a doctor would speak to a patient who has diabetes and telling them about insulin, and not like an orthodontist talking about braces. Meaning, this isn't an elective thing. This is something that you medically need, and I, as your doctor, am telling you you need this. And in myopia management, that's true, and in dry eyes, that's true as well, but kind of different avenue. In dry eye, all too often the conversation is around symptoms. Do you have grittiness in your eyes? Do you have watery eyes? And the patient is then left with deciding, do I want to spend money on this? Are my symptoms bad enough that they warrant me requiring to spend the money and do the treatment? It's really left to them whether or not they need this. The posters that we're sharing here today, the idea is that it's helping reframe that conversation away from symptoms and into atrophy. And this is now a medical discussion, meaning I, as your doctor, am trying to educate you about the dangers of atrophy and how if your glands are not producing enough of the lipid layer, your tears are evaporating. Yes, that leads to symptoms. But more importantly, atrophy gets worse and worse, and eventually it's not treatable anymore. And that is why I'm recommending that you start treatment or begin on omega-3s or do hot compresses at home and come back in a month. Whatever the recommendation is, the discussion is reframed away from, are your symptoms bad enough that you think you need to get treatment, to I, as your doctor, am recommending that you require this treatment or require this next step. And so by having these posters in the office, you're easily able to show, here's what the tear film layer looks like, here's the lipid layer, here's where that oily substance comes from, here's what your glands look like in stage 1 through 5. Stage 4 and 5, that's when it starts getting tricky to treat and it may become permanent. Then you're able to connect that to the symptoms and say, and you might have even experienced some of these symptoms that are over here. And that's when you can then go on and say, now here is the treatment that I think that you should do. It's not about whether or not you can live with the symptom, but it's about a doctor telling their patient what medically is necessary, and the patient, in general, listens to their doctor. So I hope these posters help you. Send us an email or send us a message here, and we'll send you a editable version for your office, and you can print them up and put them in your office or leave them out as brochures for your patients. Thank you.